The main vascular problem of systemic sclerosis is Raynaud's phenomenon. And what Raynaud's phenomenon is episodic digital ischemia that occurs in response to cold or emotion. In plain terms, what that means is it means that your fingers and your toes and or your nose and your ears or your lips and the tip of the tongue can turn funny colours in response to cold or emotion. And essentially what happens, what you see in the fingers is the fingers turn white first due to lack of blood flow to the fingers. They then turn blue because the blood in the fingers becomes deoxygenated. That means the blood is taken out, the oxygen is taken out of the blood. And then when an attack terminates, the fingers turn red on return of blood flow. In the main, in primary Raynaud's phenomenon, the attacks of changes in the colour of the fingers are a nuisance, but don't result in permanent damage to the tissues. However, in systemic sclerosis, what we often see is irreversible damage to the tissues. And this can manifest as gangrenous fingertips or toes, or individuals can get nasty digital ulceration. It's important that we have a low threshold for treating these patients with antibiotics to try and terminate the ulcer early on. Sometimes when ulcers are slow to heal, we have to use intravenous vasodilators. The most common intravenous vasodilator that's used is prostacyclin, and that's given in hospital as an infusion, usually over 5 days. In systemic sclerosis, we know that there are abnormalities of the tiniest blood vessels, the capillaries. If we look at the nail folds in systemic sclerosis, we see enlarged capillaries and areas of capillary loop dropout. This manifests as telangiectasia, so individuals with systemic sclerosis often have these pink spots. Telangiectasia can be a very unpleasant complication of systemic sclerosis. Individuals with telangiectasia may respond to laser treatment. Another problem which may be secondary to the lack of blood flow in systemic sclerosis is individuals get troublesome areas of calcinosis, so calcium deposits, which can ulcerate and cause problems in addition. And sometimes individuals, in addition to antibiotics for digital ulcers, intravenous vasodilators to open up the blood vessels, also need to have the intervention of our surgical colleagues to take away the nasty bits of calcium, and also if there's dead skin at the fingertip.